Welcome back to The Explainer. Have you ever actually stopped to consider that the human body is basically this highly connected, incredibly complex structural machine? We have this tendency to think of our aches, pains, and weird quirks as totally isolated events. A bad knee over here, a stiff neck over there. But what if those aren't the actual root problems at all? What if tiny, completely unseen architectural variations in your bones and tissues are causing these massive downstream symptoms? Well, today, we're going to look at the hidden deformations you likely don't even know you have, and how they are literally dictating the way you move, breathe, and feel every single day. Okay, let's dive into this, because this is a question that completely changes how we view our health. We spend so much time, and honestly, so much money, just chasing symptoms around. We throw ice on our knees, we stretch our tight lower backs, we buy those crazy expensive ergonomic pillows for our necks. But what if your chronic pain is really just a side effect? What if you're merely treating the compensation and completely missing the hidden structural deformity that's actually driving the bus? Think about the common complaints we hear all the time: chronic allergies, stubborn plantar fasciitis, bad posture. Millions of people spend years just masking these symptoms. But a lot of the time, it's a case of mistaken identity. The underlying math of the body is just slightly off. That allergy you can't shake, it might actually be a deviated septum. That plantar fasciitis, it could be a totally hidden extra bone called an accessory navicular. And that bad posture, it might just be mild structural scoliosis, a literal 10 to 25 degree curve in your spine that you've had your entire life. Part 1. The kinetic chain reaction. From the ground up. Let's see how this builds. To really understand the body, we have to start right where we meet the earth. Because foundational issues in your feet don't just stay in your feet. They ripple straight upward. In fact, here's a direct physical check you can do later today. Stand barefoot on a totally flat floor and have someone check your hips from behind. Are they perfectly level? For a huge portion of the population, the answer is just straight up no. One hip sits slightly higher than the other. And the reason for that unevenness is very often an unequal leg length. Having an anatomical difference of up to 2 centimeters is extremely common. Think about what that actually means. Every single time you take a step, there's this slight hip drop on the shorter side. Over a lifetime of walking, this translates directly into compensatory curvature in your lumbar spine and, boom, chronic lower back pain. And the crazy part? A simple, tiny heel lift in the shoe of the shorter leg can completely interrupt those compensation patterns that people otherwise spend years trying to fix with pain meds. And this brilliantly illustrates exactly how the kinetic chain works, especially when we look at flat feet, which affect roughly 30% of people. It's basically a 4-step chain reaction. Step 1, the arch of the foot, which is your body's natural shock absorber, collapses. Step 2, that lack of distribution makes the ankle roll inward, which is known as overpronation. Step 3, because the ankle rolled, the knee now has to track slightly inward. Step 4, your hips and lower back have to shift just to accommodate those altered mechanics. People go to the doctor for mysterious knee and back pain, completely missing the fact that the root cause is happening right down at ground level, where the feet themselves don't even hurt. Now, try this. Hold your foot out and just look at your toes. Does your second toe actually extend past your big toe? If it does, you've got what's known as Morton's toe. It affects somewhere between 10 and 30% of us. So why does a long toe even matter? Well, in a typical foot, your big toe is supposed to bear the brunt of the weight during your gait. It's your final leverage point right before your foot leaves the ground. But with Morton's toe, you completely lose that leverage advantage. The weight distribution shifts, the forefoot takes on way too much pressure, and that leads to calluses, an increased risk of bunions, and an altered gait that, once again, travels straight up the kinetic chain to cause subtle hip and back compensations. Now, what's really interesting about this is a massive case of mistaken identity happening right inside the arch of the foot. About 4 to 14% of people have a completely hidden extra bone called an accessory navicular. In some people, this little extra piece of bone causes a prominent bump and chronic pain that mimics plantar fasciitis almost exactly. So people spend months, sometimes years, resting and stretching for soft tissue injury they literally don't even have. What they actually have is an extra bone, which requires a totally different treatment approach and a specific midfoot x-ray just to find it. Section 2. Breathing and core disruptors. Let's move up the chain. Let's shift our focus upward from the foundation and into the torso and head. Just take a look at the brutal physics of forward head posture, usually driven by years of hunching over phones and desks. In a neutral position, directly over your spine, your head weighs an efficient 10 to 12 pounds. But for every single inch your head moves forward, the effective load on your neck literally doubles. By the time your head is 3 inches forward, your neck muscles are managing the equivalent of 40 pounds. That's like carrying a massive bag of dog food on your neck all day. This isn't just a bad habit. The cervical vertebrae actually remodel over time. It causes constant headaches at the base of the skull and severe jaw tension. And you definitely can't fix 40 pounds of mechanical leverage with a pain pill. Speaking of the head, here is a staggering statistic for you. 80%. Studies suggest around 80% of people have some degree of a deviated septum. That means the wall of cartilage and bone dividing your nostrils is crooked. Most people walking around with this have absolutely no idea. They just think they have terrible allergies or bad sinuses. They take antihistamines for years, totally unaware that the reason they can't breathe out of one side of their nose is a literal physical roadblock. Moving down to the chest, if you press the center of your sternum, it should sit roughly level with your ribs. But in about 1 in 300 people, it sinks inward, creating this hollow shape. This is called pectus excavatum, or funnel chest. In moderate to severe cases, this physical depression literally displaces the heart slightly to the left and limits how much the lungs can expand. People with this condition experience shortness of breath and heart palpitations, and for years they just assume they have poor cardio fitness or anxiety. They never realize their rib cage is physically restricting their engine. Similarly, structural issues in the core are incredibly misunderstood. Diastasis recti is a widening gap down the center of the abdomen where the connective tissue stretches thin. We see it a lot after pregnancy, but also in men who lift heavy weights with poor bracing technique. People just assume they have stubborn belly fat or weak abs. So what do? They do crunches. But actually, scratch that. Standard crunches push the core outward and can make the gap worse. The core fails to stabilize the spine, leading directly to, you guessed it, lower back pain. So the crucial point is that a restriction in one place forces the body to borrow mobility from somewhere else. Take adult tongue tie, for instance, a restriction of that little band under the tongue. Because the tongue is tethered, your entire throat, jaw, and neck have to recruit muscles completely differently just to speak and swallow. This structural tether leads to accelerated tooth decay, chronic neck tension, and even sleep-disordered breathing because it's actively changing your airway dynamics at night. Section 3. Harmless evolutionary leftovers. Let's take a quick breather from the heavy structural stuff for a minute. Not all anomalies cause chronic pain. Some are just fascinating, medically insignificant echoes of our evolutionary past. For example, hold your hand up and look really closely at your pinky finger. Does it naturally bend slightly inward, sort of pointing toward your ring finger? If it does, you have clinodactyly. Around 10% of people have this genetic curvature. And if you're one of them, don't worry. It's usually an entirely cosmetic family trait that causes absolutely zero functional limitation. You probably just noticed it one day and never gave it a second thought. Here's another fun one to look for. Next time you're in front of a mirror, examine the area just in front of your ear, right where the cartilage attaches to the side of your head. Do you see a tiny, barely visible pinhole? About 1 in 100 people have this. It's called a preauricular pit. During fetal development, the ear actually forms from 6 tiny mounds of tissue that fuse together. If they don't fuse completely, it leaves this little pinpoint sinus tract. It's just an evolutionary vestige, causing no pain and doing absolutely nothing. It's basically a silent reminder of how we're built in the womb. How about this one? A supernumerary nipple. During fetal development, we all have a milk line running from the armpit down through the torso. Usually, all the tissue on this line regresses except for the 2 primary nipples. But in anywhere from 1 in 18 to 1 in 100 people, it doesn't fully regress. You get a tiny extra nipple. They are almost universally dismissed by doctors as just a harmless mole, simply because they lack an obvious areola, and honestly, doctors rarely look closely enough to tell the difference. Finally, open your mouth and look at the uvula, that little piece of tissue hanging at the back of your throat. For 1 to 2% of the population, it's actually forked, split straight down the middle into 2 lobes. This is a bifid uvula, which is considered a microform of a cleft palate, where the midline tissue didn't fully fuse. Most adults who have this have absolutely no idea, simply because, well, nobody regularly checks the shape of their own uvula. Fixing causes, not just symptoms. So as we wrap up this explainer, let's bring all these wildly different anomalies back to our central theme. Whether it's a harmless split uvula or a collapsed arch that's completely wrecking your lower back, your body is a deeply connected web. I want to leave you with this final thought. The next time you experience chronic tension or a symptom that just won't go away, ask yourself, Are you just treating the compensation? Before you stretch, ice, or medicate, perhaps it's time to look deeper, inspect your foundation, and see if there's a hidden structural root just waiting to be discovered. Thanks for exploring with me, and keep questioning how your amazing machine is truly put together.